Hello, I'm Michelle Levander, Director of the USC Center for Health Journalism. Thanks for joining us and welcome to our Health Matters webinar, Covering Coronavirus, the Nursing Home Tragedy. We are here today to examine the disproportionate toll of coronavirus deaths in America's nursing homes and to understand and quantify the toll in your own community. We'll hear from a masterful storyteller, Reuters reporter Chris Kirkham, who opens his recent investigative report by painting a grim tableau inside of one New Jersey nursing home. There was the case of Barbara Grimes, who noticed her roommate sitting in a puddle of urine, unattended for hours as the liquid seeped into a wound on her tailbone. David Paul, meanwhile, was shoved into a filthy room previously occupied by two infected residents, along with another man. Both got sick, and his roommate died. Long-term care facilities have had an estimated 40% of US deaths due to coronavirus. Its residents, already vulnerable, have faced the added dangers of inadequate testing, a lack of protective equipment, and little in the way of public health guidance, along with enormous staff turnover and shortages. How can reporters and other policy thinkers document and quantify the scope of problems in their community and identify which facilities had a history of problems pre-COVID and which ones did better and are faring better today? In this webinar, we'll look at strategies for reporting on the nursing home shortcomings that have exacerbated the COVID-19 crisis. You'll learn how to use ProPublica's database of 80,000 nursing home inspection reports, and we'll take you behind the scenes of one reporter's gripping investigation. Here to help us explore this topic, we're joined by two distinguished speakers. Charles Ornstein is a deputy managing editor at ProPublica, overseeing its local reporting network. He's also the co-creator of ProPublica's Nursing Home Inspect, which allows users to search through thousands of nursing home inspection records to find problems and trends. From 2008 to 2017, Charlie was a senior reporter covering healthcare and the pharmaceutical industry. Prior to joining ProPublica, he was a member of the Metro Investigative Projects teams at the LA Times, where he co-authored an investigation of a troubled hospital that won the 2005 Pulitzer Prize for Public Service, the Robert F. Kennedy Journalism Award, and Sigma Delta Chi Award for Public Service. The 2009 investigation he co-authored on serious failures and oversight by the California Board of Registered Nursing and nursing homes nationwide was a finalist for the 2010 Pulitzer Prize. Chris Kirkham is an enterprise reporter for Reuters, where he's focused on worker safety as well as the tobacco industry and e-cigarettes. Based in Los Angeles, Chris has previously worked at the Wall Street Journal and the LA Times, where he covered topics including the gambling industry, the housing market, the economy, and labor issues. Chris has earned multiple awards from the Society of American Business Editors and Writers as part of a Wall Street Journal team that broke the news of sexual misconduct allegations involving casino executive Steve Wynn, and for coverage of the California economy and private juvenile prisons. This webinar is offered thanks to the California Endowment, the Commonwealth Fund, and the National Institute for Healthcare Management Foundation, as well as by individual supporters like you. You can tweet about the webinar at the hashtag #NursingHomes. A word about our format today. We'll be hearing from our panelists first, and then we'll turn it over to our audience for questions. Because we have many people participating in this webinar, we'll ask you to write your questions into the control panel of Zoom. You can write us there if you're experiencing technical problems as well. We'll be archiving this webinar at centerforhealthjournalism.org. And now let's turn to Charlie Ornstein.
Thanks, Michelle. Thanks for the kind introduction, and great to be here with so many of you today. I'm going to share my screen here, and let me do that. I'm hoping that everybody can see this. Michelle, are we set?
You're good. Perfect.
Excellent. So nursing homes are a topic that many of you have written about a lot. I certainly have written about it a lot over the course of my career. And it's one of these topics that sometimes we feel like, God, I've written so much about nursing homes. Is there more to say? But as we're learning through COVID-19, the answer is most assuredly yes. And so, I'm not, there we go. So your editor asked you to write something on COVID-19 in nursing homes. What do you do? I think that many of us have been in this position over the course of COVID-19, even though I am currently an editor. My editor has asked me to put together stories on nursing homes and indeed to oversee stories on nursing homes as well. So hopefully I'm going to equip you with some tools and suggestions for stories you can look at and how do you look at those. So over the course of our time together, I'm hoping to cover a few things. So how did we get here? Understanding, of course, that the past, particularly as it relates to nursing homes, is prologue. Where exactly are we? This actually is not that easy of a question to answer, but as best we can tell, I'm hoping to answer it. What we know and what we don't know, as well as where we are going, which at the moment involves educated guesses. And so we will talk about those as well. And then we'll loop back around to that question of your editor asking you to write something about nursing homes with some story ideas. So how we got here. I think it's really important in the context of nursing homes to remember that this is not a problem that we are seeing for the first time. Just as racial disparities in healthcare and the disproportionate toll that COVID-19 is taking on Black and Hispanic communities is not a new issue. Nursing homes being ill-equipped to deal with disasters is not a new issue either. And so I think it's helpful to just take a mini step back and look at some of the issues that we faced in the past with nursing homes and how they've responded. I think all of us remember this situation. This is just 3 years ago, where 8 people, it was actually turned out to be more than that, died as a nursing home lost air conditioning for days after a hurricane in Florida. This was a photo that was taken after that time, and this really increased pressure on Florida nursing homes with regard to having working generators that could operate if they lost power. And if we look ahead, right, so this happened in September of 2017. If we look ahead, right, the first headline you see here, 2018. Most Florida nursing homes don't have generators despite the new requirements after Irma deaths. Irma was the name of the hurricane. The next one is from 2019. After Irma deaths, 60% of nursing homes still don't have 4 days of backup power for AC. The next one is 2020. How Florida's lax oversight of elder care homes undermines its COVID-19 response. That even in 2020, they had waived rules for nearly 100 facilities that require backup generators. The reason I show you this is not that a hurricane or a loss of power is the same as COVID-19, but it is a demonstration that nursing homes have faced challenges in the past and have really fought mandates or requirements that they change their procedures and practices so that they're better equipped the next time something happens. This is just one example. To give you another, also in 2017, when hurricanes hit Texas. This was an image I remember seeing at the time. It was horrifying to see then. It remains horrifying to see. This is at a Port Arthur, Texas nursing facility where water was in. They had no organization with respect to evacuating residents. It led to a lot of calls for changes in the way that nursing homes handled evacuations. And I went back to sort of say, well, what all happened after this? It would probably not be surprising to you that this has still not been resolved. Again, going back to the central premise that as we think about nursing homes in the context of COVID-19, we can't just think about nursing homes in the context of COVID-19. We have to think about it in the full context of situations involving nursing homes. One more slide, and this is from a GAO report that was conducted just this year. There's a link to it in here. Michelle is going to share this presentation afterwards, and so you'll be able to access it in here. But essentially, the GAO looked to see the previous history before COVID with respect to nursing homes with infection control deficiencies. And what they found was that 82% of nursing homes, that's 4 in 5 nursing homes, had had an infection control deficiency in 1 or more of the past 3 years. That is an extraordinary, extraordinary figure. In some states, it's even higher. It's more than 90%. So when you think about that, I've certainly seen some stories saying like nursing homes that have had COVID deaths, more than 90% of them have had infection control deficiencies. But one thing that we often fail to remember as we're writing a story like that is that all nursing homes have had a very high share of infection control deficiencies, both those that have faced COVID deaths, those that haven't faced COVID deaths. So nursing homes have had a very serious issue with respect to infection control. They've had very serious issues with respect to compliance with rules and regulations. This is well documented over the course of a whole long time. CMS, which is the Centers for Medicare and Medicaid Services, has been faulted for its oversight of nursing homes. This is a perennial problem, and our coverage of the issue today needs to have that context of where we've been in the past. So where exactly are we? So it is surprising that answering that question is as hard as it is. Where we stand is that different states are doing different things, and the federal government has just jumped into the game. So let me sort of outline what I mean by that. In this first link is a link to the AARP, and the AARP's website, and I'll click through to it. Are you able to see the screen with the AARP website, Michelle?
Yeah.
I'm sorry?
I'm just seeing your slide.
Okay, let me change what I'm sharing here. So on the AARP website, what you're able to see is a list of every state, as well as a link to on that state how you can find what they list about nursing homes. So here's New Jersey, where I live. You can see that you can visit the dashboard and click on the long-term care tab at the top. If you're looking for data on Kansas, they don't report data. So they're telling you that you can't find anything from the state of Kansas. Florida, it's telling you how to find specifically the nursing home information that is shared for the state. So I find this really helpful because it gives really, step-by-step ways of finding the information on a particular state's website. Whoops. Trying to change my share settings here. Hold on one second. And it went to the wrong place. The second link is to the Centers for Medicare and Medicaid Services, which is the CMS oversees nursing homes, and they have recently published data on nursing home infections and deaths that have taken place there, both among residents and among staff. This applies both to states that are releasing this information, as well as states that are not releasing this information. And so on this website, you will see a variety of things. You can download data, you can see overall counts, you can search for particular nursing homes, and it has some charts and information. This is only data that is since early May. So for states that went through their peak in March and April, nursing homes were not mandated to report information over the course of that time. It was voluntary for them to report it. And there have been a whole lot of problems with this data. And that presents, an issue, a challenge with respect to this particular, how do you cover this when you're dealing with junky data? And we'll talk about that, more in a minute. The last is from the Kaiser Family Foundation, which is aggregate totals by state. So they've gone through, and this is regularly updated. They share information by state about what they release and some aggregate totals, what share of their overall COVID cases and deaths are represented in long-term care facilities. So 3 different data sources, and let's talk about sort of what you can find and can't find. So with respect to nursing homes, my view of this is that you need to check as many sources as possible. Like I mentioned, the data on the federal government's website, particularly the first iteration, was deeply, deeply problematic. So problematic that ProPublica made the decision not to use this data in any way, shape, or form. We felt it was so junky that it would be a disservice to readers and users to integrate this at all into our nursing home inspect tool. The data has gotten somewhat better, but it still does not always line up with the data you'll find on the websites of states. So if you look at this screen that I'm sharing now, you can see a nursing home called Royal Suites Healthcare Rehabilitation Center in Galloway, New Jersey. According to the New Jersey website, you see that this particular home had 57 residents with confirmed COVID cases and an additional 20 staff members. 4 residents died of COVID. When you go to the federal website, you see that their total number of residents with suspected COVID is 0. So if you were relying on the CMS data, which I just got from yesterday, it shows 0 residents had COVID. According to the state, 57 residents have COVID. And what is the right answer? I don't know. But what it is to say is that you need to be really careful about using this data without looking up as much as you possibly can and asking tough questions. Another challenge, like I said, is with the federal data. One, that it only applies from May 8th going forward. 2, this is a story from Cheryl Clark about how the first iteration of the data was insanely wrong. And the third is a blog post from the American Enterprise Institute saying the data are getting better, but note, it says are getting better. This is going to take time. And so as you think about the stories you're writing and the data you're using, it's important to not just jump on this data because it's available. We all want to have data, but we also have to be responsible with it. So I wanted to share with you a tool that we came up with a number of years ago called Nursing Home Inspect. Nursing Home Inspect is our attempt to take information that is provided by the Centers for Medicare and Medicaid Services and put it in as user-friendly of a way as possible. So what you're able to see using Nursing Home Inspect, we focus on inspection deficiencies involving nursing homes. And so you can see for each state, the number of serious deficiencies, the percentage of homes in the state with at least one serious deficiency in the past 3 years. So you can see here that in Arkansas, 44% of nursing homes have had at least one serious deficiency. In New Mexico, also 44%. Whereas if you compare it to, say, a state like North Dakota, it's only 3% of homes that have had a serious deficiency. You could see similar issues with respect to fines and with respect to infection-related deficiencies. Some of these states, as you can see, for example, Michigan, 92% of their nursing homes have had an infection-related deficiency over the course of the past 3 years. That's an extraordinary number. By clicking into the state of Michigan, you're able to see a few things. Just need to click into the state of Michigan. Okay, so you're able to see here that there are 442 homes. Of those, 141 have been cited with a serious deficiency over the course of the past 3 years. 408 of the 442 homes have been cited with an infection-related deficiency. And then you're able to see, this is ranked by total serious deficiencies, which are what we call immediate jeopardy citations. These are ones that put patients or residents in immediate jeopardy of harm or death. That's how we rank it. We also note special focus facilities, which are those that are flagged by the government for a history of serious quality issues. Special focus facility candidates that meet the criteria to be a special focus facility, but haven't been designated as one, as well as notations for homes that have had at least one COVID-19 case among residents or staff, according to the Washington Post. We believe that the Post data is more accurate than the CMS data, or at least has been. And so that's what we've defaulted to with respect to showing which homes have had a COVID-19 case. We're constantly reevaluating that. The other thing I would just show you about Nursing Home Inspect, and we could take an hour just talking about Nursing Home Inspect, but you're able to do interesting things with it. So for example, if we want to look up the word outbreak, we can search for outbreaks in a particular state. So say we want to look up California. So this is looking for the word outbreak in inspection reports in California. And you're able to see that there's 248 results. And it's going to show you, if you want to see them, you can do it ascending or descending. So as recently as February 2020, there was a report that had the word outbreak here at the Indio Nursing Center in February as well. Let's click on this one. This takes you to the federal website where you can see the deficiency report. This is what's called a 2567 form in government lingo, although I never use that when I'm writing a story. But these deficiency reports are very, very helpful in terms of understanding what the inspectors find when they go to a facility. They're your eyes and ears, right? You cannot go in and request patient records and documents, but these inspection reports can give you an on-the-ground view of what's going on. So in this case, you're able to see the write-up of what happened. It's very detailed. It doesn't include names, but it includes dates and other information. And we can do a keyword search in here for outbreak, right? And so we see here that they failed to ensure care and treatment were provided for 4 of 8 residents reviewed for influenza outbreak, right? And so how a facility has dealt with prior outbreaks could in fact help you understand what may be going on now with respect to an outbreak. But one of the very first things I would do if you're aware of a facility where something is going on with respect to COVID is you're going to want to look up its history. You're going to want to see what's happened in the past with respect to the home and if there are any violations relative to infection control or outbreaks that are relevant today. Like I said, there's more to be said about nursing home inspect, but for now, I think we're going to leave that there and sort of pick back up. Okay, so what we know and what we don't know. So what we know that nursing homes got slammed, particularly in the states that were hit hardest first, New York, New Jersey, Pennsylvania, Massachusetts. When you look at the CMS data, you'll see that those states were really hit hard. In New Jersey, 12% of nursing home residents actually died of COVID in the first couple of months, an extraordinary figure. And so that is, that you would find in the data. We know that nursing homes did not have the testing or the PPE they needed, particularly in the early days. And they were really put behind hospitals in line, and that created problems. And we know this through word of mouth. We know this through the trade groups that represent nursing homes. We know this through inspection reports and individual interviews as well. We know that nursing home staff are often low paid and must work multiple jobs to get by. And I know Chris is going to talk about staffing in a few minutes. We know that many nursing homes have a history of deficiencies like we just talked about. We know racial disparities abound, and we know that staffing matters. What we don't know whether state policies on nursing homes accepting patients from hospitals made a difference. ProPublica has reported on situations in which homes were terrified about taking patients with COVID from hospitals. They were not allowed to test them before they came into the home, and how in some facilities at least there was widespread spread of COVID after patients transferred in from the hospital. The AP similarly tried to do a count to understand the number of patients who were transferred from hospitals to nursing homes in New York. So we don't fully understand the scope of this and how this looks very different in different states. Red states and blue states acted in different ways in this respect, but we don't know if this policy was the reason there was a difference in outcomes for nursing home residents. It's one of the things I think time will play out. We don't know if a nursing home's prior quality makes any difference. So these are actually 2 different headlines. One is there's no connection between nursing home ratings and profit status, according to one study, but race may be a major factor. And then here's a report from Kaiser Health News that Jordan Rao did, and CMS has made similar statements that there is actually a connection and a correlation between the star ratings and how hard hit a nursing home was. So here you literally have 2 different sets of folks saying 2 very different things. We're going to need to let this play out a bit, and I imagine there's going to be more definitive studies coming out, but I don't think we know for sure whether this is the type of thing that affected across the board the industry as a whole, regardless of their history, or whether our nursing home's history played any role in terms of its susceptibility to spread. We don't know how many nursing home residents actually died, and we don't know this for a couple of reasons. Some states did not require homes to include in their tally residents that they transferred to hospitals and who died in hospitals. They were not considered part of the toll of nursing home deaths related to COVID. They only looked at the place of death, so you have to die in the nursing home to be counted in the nursing home. Other states included more than that. So it's really important to ask your state what is included in that, but we may never get the full total of the number of COVID-19 deaths among residents at nursing homes. And that's really troubling. And I think that is really unfortunate as well. And this is an important one. What happened in assisted living centers? That we're talking today about nursing homes, but COVID-19 did not spare assisted living centers. And assisted living centers are subject to much less regulation, much less transparency, and much less media coverage, frankly, than nursing homes. They do not get paid by Medicare or Medicaid, and therefore they don't sort of have the same disclosure requirements, the same regulations that affect them. And that makes them a bit more invisible. You can't go online and sort of look up on one website nursing home deficiencies. It really is state by state. But that makes it even more important that we not take our eye off of assisted living centers as we're covering this. So I know I only have like 1 minute left. Where we're going, we could talk about that as we get to the discussion. I was going to spend a few minutes on this, but I will skip that. Back to that story assignment though. So I'll end this here, which is, here's a variety of things that to consider as you're thinking about what are the stories you can write in your community. To assess the characteristics of the homes with the most cases and deaths. I think we are now beginning to get enough information that we can begin to make data analyses available of what's going on in our states and really providing clarity for readers and viewers and listeners. Understand what is being reported publicly and what's not. So what is the extent of the toll this has taken in your state that's known and what isn't? Looking up inspection findings of nursing homes. CMS has started making available specifically COVID-19 associated inspection reports for nursing homes that are available on these links. We're gonna share this with you so you'll have these available to you. I use these for a story I did about immediate jeopardy citations where there were very serious problems at particular nursing homes where COVID took over. And this allowed me to sort of understand what was going on the ground. You'll want to keep an eye on these survey results as they become available for your state. Right now, CMS has only put online surveys through the end of April. They're going to be putting online within a few days surveys through the end of May. They're going to once a month keep updating that. So you want to keep an eye on that. Tell the story of a home that kept COVID away or one that got swamped. To explore what nursing homes learned from prior disasters, taking an issue like Hurricane Irma in Florida, the hurricane that struck in Port Arthur, to examine what was learned, what was changed, and what wasn't changed. To look at assisted living centers, digging into racial disparities, and then finally, when you take a step back, what is changing, what needs to change in nursing homes and long-term care facilities. The last thing I want to do before I turn it back to Michelle is I created a tip sheet here. It's bit.ly/COVID-nursing homes. It includes all the data sources I mentioned during our time, as well as links to stories that I think are well done and raise important issues about nursing homes and long-term care centers. So I think I may have gone a minute over, but happy to take your questions during the Q&A. Michelle, I'll turn it back to you.
Thank you so much for this fabulous presentation. And we're going to take questions for both of our speakers at the end, and you can enter your questions in the Q&A part of your control panel at the bottom of your screen. And now we're going to turn to Chris to talk about his really important investigation of nursing homes.
Sure, yeah, thanks for having me. And that was a great overview by Charlie. Let me just make sure I get this screen shared. 1 second. Okay, is that, everyone can see that?
Perfect.
Okay, great. So I'll talk a little bit about a specific, this is sort of a story that we put out a couple weeks ago, and kind of take you through how we sort of formulated the story idea and a little bit of the reporting that we did. So we kind of got started on this, admittedly, I guess, kind of late. There had already been a lot of great journalism out there on nursing homes, including by Charlie and some of his colleagues, Washington Post and many others. So we were kind of struggling, I think, with some of the same data issues that Charlie kind of discussed there. We had there was basically we had this question of we'd love to be able to dig into this CMS data and past inspection data to see, if certain homes that were experiencing outbreaks, it had a history of deficiencies, kind of all those sorts of questions. But it was really difficult to understand exactly you know, which homes frankly are having outbreaks because the data was so spotty. The federal government at this point was not really collecting it in any comprehensive way. States were very scattershot. You know, you started to have some states that would report just the sort of aggregate numbers of deaths, but they wouldn't say which facility it was. It was just sort of in nursing homes, period. You didn't know exactly the methodology that they were using to count who died in a nursing home, who contracted COVID in a nursing home, or, you know, if they were moved to a hospital, does that count as a nursing home patient? So we had all these kind of data issues. But we also wanted to do something bigger, and we wanted to, you know, there were a lot of great stories sort of about individual outbreaks and how those occurred, but we wanted to see if we could get to something a little bit more systemic. So we started really just kind of thinking about staffing. So this was the, sorry, 1 second. Okay, so this was the story that we did. We decided to focus on staffing, one, because staffing has sort of long been an issue in nursing homes. And kind of anecdotally, we were hearing, you know, just as we started to sort of nibble at this a little bit, we were hearing from a lot of workers saying, you know, staffing, yeah, had always been a problem in the nursing homes. We were always short. You know, patients were often sort of not getting the care that they needed. But wow, COVID has really just sort of blown a hole in that entire system. And, you know, we hearing reports of, you know, staff who were fleeing nursing homes, you know, both because they were getting sick and they didn't want to come back, or there was just the fear of getting sick. So, you know, we're sort of just hearing these anecdotes of really overworked staff. You know, and this was sort of, you see this photograph, like this hero's work here has sort of been you'll see this a lot at sort of healthcare facilities all around. But, you know, we started initially as I was just kind of calling around and, you know, looking at social media, seeing kind of what nursing home staff are saying, you're hearing a lot about kind of a disparity between what you're seeing about what the companies and what the healthcare providers are saying about sort of these heroes who work for them, and then sort of the accounts from the workers themselves who really felt that they were not being treated like heroes and were not given the sort of support that they needed. So anyway, so we decided let's take a look at staffing and let's kind of try to get a grip on what the staffing situation was like coming into COVID-19 and sort of how well homes would have been prepared, and, you know, kind of mash that up with what we're hearing from workers on the ground. So get a little bit to our analysis. So we sort of had always known that staffing had been an issue in nursing homes. We wanted to put some numbers to it. So we sort of, Ben Lesser, who is a great data journalist, he and I sort of put our heads together for a while and started thinking about, okay, how can we kind of come up with systemic sort of way to grade staffing in nursing homes? So we used the nursing home compare data, which Charlie alluded to, and we decided to go with sort of the most recent quarter of data that was available. So that was the last quarter of 2019. And so we then started to look at, like, okay, so what are the staffing requirements for nursing homes, period? And we started to learn, like, from a federal perspective, it's pretty minimal, and it hasn't really changed in a long time. It really, I think in a few decades, it's pretty much been the same, where, you know, there's a requirement for an RN to be on staff at least for one shift, so 8 hours a day. And then, you know, another nurse needs to be available the rest of the time. But we sort of, what we're hearing from sort of advocates and from experts was that this was a shortcoming in particular because it doesn't get to the CNAs, who are sort of the direct care nursing assistants, who anyone who works in nursing homes will tell you that those are the people who do the bulk of the work. Those are the people who are changing, feeding, bathing residents, and the residents really rely on them to, you know, to really get through the day. And so, so basically we started looking at, you know, where are there requirements for direct care staffing? So not just nurses, but also CNAs. And so we started looking around. California recently updated its law in 2017 that provided sort of a specific number to this. And other states have numbers too, but we decided to go with California because it's among the higher staffing standards in the country. It's also pretty recent, and it's big. There's a lot of nursing homes in California. So So we basically looked at the California standard and then basically applied that to all nursing homes across the country. And then we also kind of came up with another standard, which was this higher standard here of 4.1 hours of direct care staff. So that's about half an hour or more of direct care required than the California standard. So basically what we found was that 37% of homes across the country would not have met the California requirement, and at least 70% would have failed to meet this higher bar. And that bar was basically set on, there was a report back in the early 2000s that basically decided that below this level, you can see declines in patient care. Sort of a government survey that had been done. So we decided that was a fair standard. So that was kind of it took us a while to get here, but that was our kind of framing as far as the data to kind of give us sort of a way to zoom in. So realizing this is a systemic issue, then we kind of needed to get into, all right, so what's happening on the ground? What are people saying? And so to do that, essentially I do what I do in a lot of these stories to try to get inside businesses, or, can use this for any government agency or business but it's just call tons of people and create a list of as many people as possible to reach. So to do that, you need to get names. So this is kind of an example of some ways I do this. I mean, I'm not telling you probably anything you don't completely know, but like social media is a great way to find people connected to certain companies, certain homes. LinkedIn is often very useful, but I found in pursuing nursing home stories that it's not as common that nursing home staff are going to be on LinkedIn. But I don't know why that is, but just didn't find as many on there. Some you did, but just harder to track down. So Facebook and Twitter were Facebook was the most useful. So again, this is just sort of an example here, but you type in the name of a nursing home, and you kind of need to try a few different variants to get at what people might put on their profile. And I would urge, just when you're trying to find people, like, I mean, I create a spreadsheet usually, and just, I think by the end of this story, I probably had 250 names on this spreadsheet, and, maybe 5 to 10% of them I actually was able to reach or actually, call me back. So you just kind of just be patient and don't worry about rejection, because you're going to get a lot of rejection. You're going to get a lot of bad phone numbers, but first just get the names, because names are sort of the currency in this game. You get names, they lead you to more names. You just really need a way in. And so here, you can see, like, there's a number of people who are going to come up. I had a lot of luck with CNAs, certified nursing assistants, because frankly, I mean, they work a lot of hours, they work a lot of crazy shifts. They see what's happening on the ground, and they have the most interface with the patients and the residents of the facilities. So they were a very helpful resource. So usually, like, you've probably learned, I mean, Facebook's really can be helpful, but it's also, if you're not connected to people, it can be very difficult to know if you send them a message, do they actually get it? A lot of times they might not, because it goes into that sort of folder of, requested messages that no one ever checks. So usually I would just, use Nexus or TLO or, any other kind of like resource that you might have in your newsroom to just get numbers, emails, anything you can for these employees, and then just start calling. And it's kind of can be a long and torturous process sometimes, but I would just urge you to just keep trying, because you kind of never know where it's going to lead you. And I'll sort of give you an example here. So Rob and Esau, she was a resident at Hamilton Center, which was which was sort of the nursing home I used as the lead example of my story. And it's an interesting story of how I got to her was basically I used that Facebook method that I showed you in the last slide. And I found, probably after 14 tries, I found a CNA who, a nursing assistant at the facility who I started talking to. I think she was really surprised to hear from me. Didn't exactly, I kind of was like, hey, I know I'm calling out of the blue, but just would like to talk about this. And so anyway, so she connected me then to Robin. And Robin ended up being kind of a perfect source because Robin used to be a social worker. She took copious notes. And so any of these examples that I needed, so Robin had this lead example where, basically she had been, staffing had been so short at this facility that she, often rang a light that was on her bed and the light would turn on. And she got used to basically no one ever coming. And then it got so dire that basically she would turn on the light and then someone would just turn it off because they didn't have enough staff to get to her. And so she had like notes of like the day that this happened, how many times it happened. She was kind of, an amazing source in that way. And she connected me to, many other residents at the facility who I talked to. And those were some of the other examples of Barbara Grimes, who was a woman whose roommate, had basically been sitting in this pool of urine for hours until someone came, and she connected me to a man named David Paul, who ended up contracting COVID-19 along with his roommate after they were sort of moved into a room that had not been properly cleaned. So anyway, lesson of all this is just keep trying, and it usually pays dividends. You can find someone like Robin down the line. Let me move on. So same sort of thing. So Life Care Center of Neshoba Valley, this was another nursing home where I kind of did a similar approach where I just scanned Facebook for as many names as I possibly could get. I think the first person I got in touch with hadn't even worked there during the outbreak, but basically had was still in touch with some people, and she forwarded me onto them, and that sort of built out a larger network. And I was able to get some really great accounts from workers who had quit, who had fled the facility, just saying they had been sort of left in the dark about the spread of the outbreak, that they hadn't gotten testing when they needed it. And then that led me to some current employees also who, also told me some similarly kind of harrowing accounts of the staff situation where, one example was that it got so dire that basically a teenage trainee nursing assistant, who was like at a local vocational high school, it was so short that basically she had been left alone on a wing with 30 dementia patients by herself, and then the staff finally kind of jumped in and said, "Hey, this is unacceptable. We need to send her some help." So got stories like that, and got stories of people were dying at such a rapid clip that the few nurses who were on staff just didn't have time to even be with them as they were dying because they had to attend to so many other people. And so often, this one nurse, I'll talk about in a second, she would just leave like her phone with them so they could, FaceTime their family. But she didn't even have time to stay with them. So some really, really kind of sad stories, but, again, it was just sort of plugging away at trying to find people and getting some of these stories to really, build out what we had found in the data about staffing, to add another layer of sort of how COVID was really deepening the staffing crisis in nursing homes. So this is another staffer who I talked to. This is just another example kind of on the reporting front. I did talk to unions a lot for this, and they can often be a helpful resource. I would say don't rely completely on unions, but when you're trying to find people, just go after as many points of contact as you possibly can. Gabby here had a really kind of harrowing story of the staffing situation being so short at her New Jersey nursing home that she was starting to feel sick. She wanted to get tested, so she asked if she could leave, and her boss told her she needed to basically finish the shift there. Then she went and got tested the next day. The boss said, you need to continue to come into work until you get the test results. She got her test results later that week that came back positive, but the boss still wanted her to come in and basically said, are you symptomatic? Because if you're not symptomatic, we still want you to come in. And this kind of gets to some of the issues around, we don't know exactly, but these staffing shortages and these dire situations, very well could have, led to some of the outbreaks that we've seen. Because, I mean, if you really think about how COVID transmits, nursing home residents have essentially been on lockdown. So they're not out in the community. So, it's really the workers who are the likeliest vector for this. And so when you have kind of these staffing situations where you're just so desperate to get someone in there that, you're willing to have COVID positive workers coming in, it kind of really underscores some of the challenges these homes are facing. The last thing I'll talk about is, this is kind of just, we can talk about this more later if anyone would be interested, but so I had two nurses from Life Care, this Life Care facility in Massachusetts, who, ended up going on the record, and they still worked there. And, to me, I think this was just an example of I try to protect my sources. I found out soon after the article ran that both of them, essentially were facing retaliation from the company the exact same day, which is 2 days after the article. One was told that there was an investigation into improper administration of drugs into one of the nurses. And then the other nurse was basically told right ahead of her weekend shift that she cannot enter the building. And then one of those nurses ended up getting fired. So, I try to tell, I can't promise it always, but I always try to tell sources, if you speak to me and if something happens, if you face retaliation, I'll do a follow-up story on that, because, I think that's news in and of itself. So this was one nurse who ended up getting fired. This was the other nurse who was essentially barred from the building. I think the follow-up story helped. In that story, we had the Massachusetts Attorney General quoted, on the record about this specific incident, saying they take allegations of workplace retaliation very seriously. They already had an investigation into this home going. So we'll see what happens there. But I think this may not be the end of the story as it relates to these nurses. So anyway, I'm happy to answer any more questions in the Q&A, but I just kind of wanted to take you through how I approached that one particular story.
Thank you so much. Really two such fabulous presentations. I'm so appreciative, and I know our audience is too. We have a lot of questions here. So I will start to go through them. And so one question is from, it's kind of I'm going to combine questions from two people because they're similar. One is from Natalie Megas, who says, regarding sources and finding people on the inside to talk to you, some sources are reluctant to go on the record. How do you recommend approaching sources, especially for freelancers? And then Brenda Gazar asks a similar question. What about the fear of retribution that residents and staff may have? How do you deal with that?
Sure. So, I mean, this is one of the toughest questions, I think, in journalism. You always want to push your sources to go on the record because that's going to be the most credible. And it's unimpeachable when you have that. It's very clear who's saying it. You obviously need to fact check like crazy, but you also have these questions of retaliation and I would say that the situation that happened there was quite rare. I would say most companies don't don't so quickly kind of go after employees in that way, because I mean, in some states that there could be, you know, huge legal ramifications to that, and you know, in general, I would say it's probably not the best PR move. So, you know, a lot of times, you know, I think you have to play it by ear. I think a lot of times sources, even sources who may go on the record, they may not initially be willing to talk to just sort of a random person calling them on the phone, asking them about their life and their work. You know, sometimes you have to think about, put yourself in their shoes and imagine if you just got a random call from someone you don't know, asking you to tell them all your secrets. You have to kind of approach it gingerly. And so, you know, I would say just the best thing you can do is, you know, if they want, you know, if try to get them on the record at first. But if they won't do it, then just say, hey, I'd love to just hear, and I'd love to learn about this. And, but then I would also say, just keep in touch with that person and keep coming back to them with more information, show that you're really willing to put in the time. And I think as more of a relationship evolves with the source, you know, sometimes you can revisit that question of attribution.
I would just add a couple things to that if I can. First, I think that part of our jobs as reporters is to not just expect to find sources and have them talk to us when we need them, but to always be listening. And what that means is that, like on ProPublica's site, we have a ongoing call out for people to report any sorts of things that they observe if they work in a healthcare setting, or a doctor, a hospital, a CNA, a patient, a family member, to report anything that they're observing. We get a lot of tips through that, people who work in nursing homes, people who want to share their stories. And so by always being listening, then when you're in a position where you're then going to folks to ask them, sometimes you're in a better position because those people have already contacted you. So don't just look at it as when I'm ready, like sources will be ready for me. So to be listening constantly. The second thing is, I do think in this time of COVID that what you're finding is that there's a huge amount of retribution by hospitals, by nursing homes, not just in response to talking to the media, but for voicing any sort of concerns at all. I'm thinking in particular of two different ProPublica stories where people, even before talking to us, sort of raised an objection internally and were just fired summarily for not being a team player or not doing something. Those are people who actually you want to reach. I think that people who are recently former employees, and particularly those that, you know, had a falling out over the response to COVID, oftentimes they'll have texts, they'll have emails, they'll have other things that they can show you, and having a document trail to back up what was going on contemporaneously makes their story even more unimpeachable.
And we have a question from Candice Montague for Charlie. When you said examine racial disparities, could you provide example of some data points to look at?
Yeah, so first thing, it appears to me that I gave the link to my tip sheet that in fact may not have worked for everyone, and I had to, while Chris was talking, go in and change some settings. So can I give that again, just because that includes some links that may be helpful? It's bit.ly/ and I've changed what the slash is, it's COVID-19 / nursing homes. If you go there, you shouldn't have to click a link to get my permission to view the tip sheet. That should be viewable by everyone. So if that's not the case, let Michelle know, and I'll try to figure out what's wrong or send her a hard copy of it that she can share with attendees. But it's bit.ly / COVID-19 - nursing homes. On the racial disparities, the New York Times had a really nice story about racial disparities, and there was an expert who testified before Congress that showed that nursing homes that serve predominantly African-American older people were hit much harder than nursing homes that serve predominantly white older people, even in areas that were, you know, hard hit by COVID. So it's not that you're comparing a nursing home in Kansas to one in New York, that even in the regions that were hard hit, there was disparity as far as the way that this happened. And I think we need to understand more about why that took place, and the parameters in which that took place. So I think that this will be emerging, and as there have been massive racial disparities overall, the role that nursing homes played in it is not fully understood yet.
Thank you. We have a question from Sean Rosenberg, who says, won't state licensing programs focusing on enforcing infection control regulations result in more violations. This is akin to more COVID testing resulting in the detection of more cases. Conversely, fewer violations may be the result of weak enforcement, not better nursing homes.
So I'm going to push back on the part about more testing resulting in more cases. I think that is what the president's line is on this is just not correct. But I do think that yes, if people are looking for infection control violations, they do find them, and I think that states that aren't looking for them don't find them. And one of the things you're able to see through Nursing Home Inspect is that there are wide disparities between the way in which different states regulate nursing homes. So it wouldn't be appropriate entirely to compare sort of a nursing home in New Hampshire with one in Vermont, given that they have two very different regulatory, schemas. That said, within a state, I think it is reasonable to compare different homes. So even if a state is more lax in terms of its infection control oversight, there are going to be some states in that, some homes in that state that have been cited. And so even in a more relaxed regulatory environment, the places that are getting in trouble, that should be an indication that, potentially there is a problem at those places. It's like the Joint Commission, which is a hospital accrediting group. What I always say is that being accredited by the Joint Commission isn't news. It's that if you have any ding on your license, on your accreditation at all, that is news, because it takes so much to get a ding on your accreditation that if you actually have one, then that's an indication of a real problem. So I think the same is true here, that yes, it makes it hard to compare across state lines, but not necessarily within states.
And we have a question from Robert Moore, and I apologize for the echo here. He asks, how can you check the federal data in states like Texas that have extremely limited transparency about COVID-19 in nursing homes?
Yeah, so the one nice thing about the federal data is that it's nationwide. So Texas, you're right, has been one of the most secretive with respect to facilities and COVID-19, but the state rules don't apply to the federal government. If the nursing home accepts Medicare or Medicaid funding, they have to file this information with CMS. There are some nursing homes that aren't. They're going to be fined for not doing so. So the rate of compliance is really high. I'm not saying accuracy, but the rate of compliance is really high, and that nursing homes in Texas are reporting this to the federal government. And also, all of these inspections are public. They're considered sort of on their face public. And so there may be a lag in terms of releasing them by a few weeks, but whether it's in Texas or Florida, they are releasing them. They're releasing them in batches. You can see the link to download those on the tip sheet, and that applies to all states regardless of their level of transparency.
Yeah, and I would say just obviously spot check that data, but I've noticed, like, sometimes if you go back to the CMS data, like week after week, some of the issues, like some of the early issues with case counts and death counts, some facilities have started to correct those as the weeks have gone by. So if you go back and look and see, why were there 0 at this facility in Texas when I know at least 15 people have died there, you can go back often, and sometimes, though not always, they'll update that. Plus, I think you can also maybe try to use the federal data as leverage with the state there to see if maybe you can push them to, be more transparent. I know this has sort of been a longstanding issue with reporters in Texas throughout the outbreak, but I would say use all the levers you've got.
We have a question from Whitney Downard, who says, my state, Indiana, won't release data on COVID-19 in nursing homes, and denied records requests by saying they don't have data, quote, in a collective form. And then, so I don't know if you have any strategy suggestions for Whitney, who goes on to ask what problems it could lead to, and what should states be doing when it comes to collecting data?
Right. I mean, so this is similar to what Robert was mentioning in Texas, that some states are just really dragging their feet when it comes to releasing data. So the Kaiser Family Foundation site is a good place to look to see what states releasing what information. So the first thing you want to do is just make sure you're not missing it as far as, you know, where it potentially is. Some states hide these things in weird places. And another thing you can do is submit a Public Records Act request where you're seeking emails or correspondence between state health officials about why they're not releasing this information. Is there lobbying that's taking place by the nursing home industry or particular nursing homes to try to hide this? FOIAs are turning up a whole lot of interesting things. My colleagues did a project about meatpacking plants, and the correspondence that was taking place within health departments and between health departments and meatpacking companies was super eye-opening. So a part of your strategy should be to understand the discussion taking place at the agency about releasing this information.
I totally agree. And I would say, yeah, I mean, it can be hard to just do a story about a lack of data, but I think to what Charlie is saying, I think if you can kind of triangulate in other ways, get at discussions that might get at the data, you know, a lot of times some of these homes will just sort of anecdotally say, like, you know, to families, you know, how many people have died. So I think you could try to just, like he's saying, build a story out of this, you know, keep needling the state, but like use your own reporting to sort of report around that and build a better story that, you know, in the end could pressure them to do something more.
Two additional points, Michelle, because I think this is relevant, you know, outside of Indiana as well. One, as Chris said, the federal government requires homes now to notify families if there is an outbreak in the facility. I think that's 3 or more cases, maybe 2 or more cases. So that is something which has to be done, so families are in the know. Second thing is you could use obituaries, which can be helpful. Oftentimes people will list in somebody's obituary where they lived. So by looking up on a site like legacy.com and their obituary finder, you're able to actually do a keyword search. So by typing in the name of a nursing home and setting your parameters, say within the past 60 days, you're able to find any obituaries that mention the facility, and that can then help you contact family members to determine if in fact, you know, there was a COVID situation there.
And we have 2 questions, one from Brenda Gazar and one from Ingrid Utek, asking about good strategies or good data for looking at assisted living facilities for infractions or problems.
So this is really state by state. As I mentioned, there is no federal regulatory apparatus that oversees assisted living facilities because federal money is not used to pay for them. Federal government does not actively oversee them. So you really have to look at what's going on in your state. Some states are more proactive than others, and you can find those inspection reports online. Others don't really do inspections. So I think the Kaiser report that I linked to in my presentation, and hopefully Michelle can share that, but they just did a report within the past couple weeks that looked at individual states and what they do. There have been other reports that have sort of looked at the differences in transparency between states and what you can find by state. So I think it's so variable, and that's part of the problem.
And Penelope Overton has a question. She says, the CMS data for my state, Maine, does not match the info that our state CDC has reported. When I contact the nursing homes, they say they are being asked certain things, like how many people need to be tested, and find it reported differently, such as suspected COVID-19 cases. Can you talk about this and how we can correct for this without contacting every single home in the state?
Yeah, what I tend to do, and Chris, you can jump in as well about your sort of techniques, is I try to take in a situation like this, case studies where I'll take 3 or 4 homes in this case and really try to immerse myself in all the data that I can get and what they're willing to share to understand where are the fault lines, where are the points at which, you know, this may be misreported, because that then helps me make, you know, decisions. I tend to do that with all data sets. I think researchers discard outliers and reporters embrace outliers, because outliers help you understand sort of the parameters of how data can go wrong. And in fact, when you use CMS's initial data on the number of cases and deaths at particular homes, just looking at the outliers, you were able to glean that there was a massive problem with that data set. And so I would do the same here, which is to look at the data being released by the feds, take a handful of homes, compare that to the state, see if the homes are willing to talk to you and share the information that they submitted to both, and then try to make your own determination about which one is more potentially reliable.
Yeah, I would agree. And I would say also, like, you know, kind of do some truth checking on kind of consistency of data. And like, I don't know why I remember this, but at one point I was reaching out to like all the states. And I remember Maine, I don't think they had like a specific portal, but I remember like the state epidemiologist, like every single day was like giving updated numbers on nursing homes. So I would go back and you know, maybe try to plot out the data over time, and see if it's lining up. Because I mean, I would say if a state has been sort of consistently reporting data, and that data is making sense, you know, cases are growing or an outbreak is over and cases have plateaued. I mean, that to me is going to be more reliable. And then, you know, I think I would also check with the state and, you know, just say, because I mean, I had to do that on one of these homes where there was just a massive disparity between what the state had been saying all along and what was being reported to the federal government. And ultimately I found out that, you know, it was essentially there was some confusion about the survey question from the federal government, but the home had only reported cases in May, as opposed to the cumulative cases, and most of their cases were in late March and early April. So, yeah, I don't know. For the Maine specific, I remember that like there had been some reporting of these numbers throughout. So I think that's a pretty good indicator that those are going to be solid numbers, especially if the federal numbers are just way out of whack.
We have a question from Paul Clayman who says, both of you work in big newsrooms. What if you're a freelancer and you can't use tools like Nexus? What tools might you use to track folks down?
It's a good question. I mean, I would say use tools like use LinkedIn, use Facebook, try to contact people through there. Sometimes on Facebook, I don't know, I've gotten a little, you know, you sometimes have to get a little aggressive with your searching, but like, you know, see if you can find friends, see if you can find people who've commented on posts of particular people you're trying to find. Sometimes people might have an unusual name, and then you can find that unusual name through white pages or kind of other free resources. You know, that's kind of what comes off the top of my head. You know, Charlie, I don't know if you've got other thoughts.
I would add Yelp to the list. Some people do post reviews on Yelp, and if you are a member of Yelp, you can send messages to other members of Yelp. It's hit or miss. I would say anywhere between 1 in 4 and 1 in 2 people reply to messages I send on Yelp, but it's better than nothing. And that can be really helpful in a situation like this. If people are really upset about something, they will try to post a review about it, and so you can contact them, that way.
Yeah, and then I don't know. I mean, some states, I don't know. I mean, you can go down all kinds of rabbit holes, but sometimes you can get AG complaints that might have personal contact info or phone numbers of people in them. That I've had success with that sometimes. And then I think also, for nursing homes in particular, I think a lot of states have ombudsmen, kind of like long-term care ombudsmen, who can also be really helpful. So yeah, I would do everything you can to try to track someone down. I know it can be difficult if you don't have all the resources you'd like, but I would say then sometimes just create a bigger list and get people who you can get numbers for.
Sorry about that, I was muted. Just quickly, one freelancer wrote that she subscribes to whitepages.com for $5 a month. So just another tip for other freelancers. We have a question from Rosa, and she asks Rosa Salter Rodriguez, and she asks, what would tip you off to bad data, the problems with CMS data, so that if someone were to be, trying to do something using data that where the problems haven't been as well documented, what steps do you take to check the data?
Yeah, I mean, I often just sort. And so looking for the total number of cases or total number of deaths, and I may compare that to the total number of residents. And if the total number of cases or deaths exceeds the total number of residents, then that raises some pretty serious questions. Sometimes it's multiple times as many residents as the home had, so that raises questions too. I would also, like I said, compare it to the state data. And I gave you an example of taking a home in New Jersey and comparing it to the federal data. I would do that in a number of cases in your state to just try to understand the parameters of what it is that you're working with.
Exactly, yeah. Go big and go small. Go big on the aggregate, double check that, and then spot check spot check specific instances that you believe to be true.
And we have a question from Deborah Schock. She asks, what do you see as the COVID-19 risk in continuing care facilities, which have a whole a continuum of care and levels of severity, sites that can contain nursing homes plus assisted living and independent living? Do such facilities share staff, laundry facilities?
I suspect that's going to be pretty idiosyncratic. I think different facilities are going to operate in different ways. I know that there are different rules now that are relating to nursing homes and nursing home staff. And so if they do share staff, for example, they may have to do different things with the staff that anybody who would be in the nursing home. But I think it's an area that's worth exploring. I don't think there's an easy answer right now.
We have a question from Jennifer. Oh, I'm sorry, Chris, were you going to add something?
No, I agree.
We have a question from Jennifer Salazar-Biddle. She says, there's so many problems with nursing home care. What policy changes do you think would have the biggest impact in saving lives during this crisis?
I mean, it's hard for me to, I guess, opine on sort of what policy changes should or shouldn't happen, but I would say this crisis has, to me, certainly raised some questions. I mean, about staffing. I think there should be sort of, I think there should be a hard look at sort of staffing requirements. I also think, I'm trying to think, Charlie, jump in with anything else you think, but I think, I'm trying to think. I mean, in terms of, I think one big question that I've got coming out of this is whether the data, so CMS put a sort of a hold on a lot of data collection amid coronavirus, and I'm going to be interested to see if we're going to get that data after all of this, if there's going to be sort of a requirement to fill in the gaps so that we really do understand, what. I think without that data, it's going to be really hard for us to know. And I really, I guess, I hope that even if we're not collecting it now, that after all of this, there is some sort of requirement to go back and, and put that into the CMS database. And I think that will give us a lot more understanding of because I think we do have a question of does lack of staff, have anything to do with an outbreak, or as I think some studies are starting to show now, does it have to do with, I think the industry is pushing this a lot. Does it have to do with just simply community spread? Is a nursing home located in a place where there's a lot of community spread going to have a worse outbreak than a place with tons of past infection control problems, but that's in some corner of the country that hasn't had any spread? I think those are going to be really important things to analyze. And I think, I do hope also, I guess we'll also see if this is a sort of a moment to sort of re-examine some of the funding mechanisms for how we care for our elderly. Because I think rightly, I think the industry has sort of argued that a lot of people just don't really want to think about, we kind of box this industry in a corner of our minds that we sometimes don't want to think about and don't want to consider. And I think this crisis has kind of revealed some of the consequences of that. So it will be interesting to see if there is going to be sort of an extended discussion about rethinking funding mechanisms for particularly Medicaid and quality of care.
Yeah, I guess I would just add that, yes, I mean, we're not in a position to opine. So it's hard to give you sort of a list of things that need to be changed. But one thing I think became clear through this that I'm thinking about is that in communities' prioritization of where resources went in the early days, whether it was PPE or testing, nursing homes were not seen as a top priority. And it's clear that that was, a mistake. It prevented us from identifying cases in nursing homes and from homes were really running out of PPE, and you can't help but think that that was played some sort of a role. So I do think that thinking through the role of nursing homes in the spread of outbreaks is something that's really important.
So we have a lot of questions here. You guys are popular. And unfortunately, we don't have time to answer all of them. We do have a new feature that we're running every week called You Asked, We Answered. And maybe we could take some of those questions and run it by our two speakers and share, if they're willing, afterward in that blog post. But I think we'll close with one final question from Chelsea Ceruzzo, who says, aside from asking about what states consider a nursing home death, if the person died in the nursing home or in the hospital, etc., what other questions should reporters be asking of their states when trying to understand their data collection methodology?
Well, I think one of the questions for me that I sort of struggle with is that a couple things go on in nursing homes just in the normal course of events, right? One, you're dealing with a very frail population potentially, and some of those people are going to die. So dying, if you're in a nursing home, is to be expected. Somewhere, and I'm probably going to get this wrong, but somewhere between, I think, 25 and 33% of residents in a nursing home, whether it's die over a month or a year, I'm going to get this wrong, but you can look this up. There's a high rate of death in nursing homes. It's a frail population. Second of all, there's also quite a bit of turnover in nursing homes. And so trying to calculate sort of numerators over denominators can be really tricky, right? There is a sort of a throughput in homes as people, particularly in better times, have elective surgeries, hip replacements. They come in and out of the hospital. Maybe somebody dies, maybe somebody goes home, they fill the bed. So understanding numerators and denominators to understand the spread of something in a particular home, I really feel like we're not there yet, and I would like to understand that a bit more.
Thank you. And so with this final question, we're going to conclude our webinar. I want to thank our two amazing speakers, and I want to thank all the participants for their thoughtful questions. We're going to be archiving this webinar at centerforhealthjournalism.org, and we'll be sending all of you a survey where we ask you questions about this webinar and future ones. One of our questions is going to be about the database that ProPublica created, and Charlie has graciously offered to do a more detailed exploration of that and how you could use it should there be enough interest. So please take a moment to answer the survey. And with that, and one final thing, this will all be archived on centerforhealthjournalism.org. And with that, I would like to thank all of you and have a wonderful day.